Hi, my name is Chelsea Hartigan, and here's a presentation on hyperthyroidism. So first, what is hyperthyroidism? This is the hyperfunction of the thyroid gland, which is our butterfly-shaped gland that sits in front of our neck. So what happens is the thyroid is making more thyroid hormones than the body needs. We know that thyroid hormones control the way the body uses energy, so they affect nearly every organ in your body, even the way your heart beats. So pretty much everything speeds up. And when we look at some symptoms that can occur, we'll see how everything is sped up. We do have primary versus secondary hyperthyroidism. So our primary hyperthyroidism is caused by the thyroid gland dysfunction. So Graves' disease, toxic multinodular goiter, and solitary toxic adenoma, which we'll talk about later. Graves' disease is the cause of 50 to 80% of hyperthyroidism. Then we have central or secondary hyperthyroidism, which is less common, which is caused by a TSH secreting pituitary adenomas. So what causes hyperthyroidism? So we have Graves' disease, like I said, which causes 50 to 80% of hyperthyroidism cases, inflammation of the thyroid gland, such as thyroiditis, overactive thyroid nodule, excessive iodine, which, fun fact, amiodarone, a medication, can cause elevated levels of iodine. So you would want to test a patient for hyperthyroidism if they're taking that medication. Excessive thyroid hormone and non-cancerous tumor of the pituitary gland are all causes of hyperthyroidism. So what are our risk factors? Our risk factors include women, so females, and who are ages 30 to 50 years old. So what is the pathophysiology of hyperthyroidism? First, I'd like to talk about Graves' disease. Graves' disease is an autoimmune disorder that causes an increase in the thyroid hormone. So pretty much we have autoantibodies called thyroid-stimulating immunoglobulins that override the normal regulation of the thyroid hormone. This results in hyperplasia or goiter and increased levels of T3 and T4, which we'll talk about later, but those are the thyroid hormones. Symptoms then start to occur. TSH production by the pituitary is inhibited through the usual negative feedback loop. Nodular thyroid disease is when the thyroid gland enlarges as a response to an increased demand in thyroid hormone through pregnancy, puberty, and iodine deficiency. This can also occur due to immunologic, viral, or genetic disorders. When there is a demand for the thyroid hormone, irreversible changes occur and form nodules on the thyroid. Toxic multinodular goiter occurs when there are several nodules leading to hyperthyroidism. There is an increased incidence of malignancy with a toxic nodular goiter. I also wanted to mention thyrotoxic crisis, also known as a thyroid storm, because this is a deadly worsening of hyperthyroidism. There is a dramatic increase of the thyroid hormone, which can cause death. This occurs in individuals with undiagnosed or partially treated Graves' disease, or those who are subjected to illness or stress. So what are we going to look for with our patients who may be have hyperthyroidism or suspicious of having hyperthyroidism? First, we'd want to start with our health history. So it's good to assess our health history and our family health history because hyperthyroidism can be genetic. These patients, like I said, everything's going to be sped up. So they're going to be nervous, irritable, hyperactive, they have emotional ability, decreased attention span, change in mental status, weakness, insomnia, weight loss, increased appetite, menstruation irregularity. So what happens here is the cycle either will slow down or it might stop completely. They also may be warm and sweaty, and their hair might start getting thin. I wanted to mention two symptoms you might see in patients specific to Graves' disease. So we have exophthalmos, which is the protrusion of the eyeball. So due to the enlargement of the ocular tissues, this can cause double vision, blurred vision, decreased visual acuity, photophobia, and corneal ulceration. So this is a concern. with these patients: a goiter, which is a large buildup of tissue on the thyroid, and pretibial myxedema, which is subcutaneous swelling on the anterior portion of legs due to increase of hyaluronic acid production in the dermis and subcutaneous tissue. This can appear on the hands as well. I have added some pictures here of the pretibial myxedema, which is on the left, and the exophthalmos, which is on the right. So what lab findings or diagnostic tests might you see for patients with hyperthyroidism? So of course we have the thyroid stimulating hormone. So this is the hormone in the pituitary gland that tells the thyroid how much thyroid hormone to make. So usually this decreases in hyperthyroidism because the thyroid's already making too much hormone. We don't need another hormone telling us to make more thyroid hormones. So it pretty much stops production. We have thyroxine, which is T4, and triiodithyronine, which is T3. And it's really good practice to test both T4 and T3, which these are our thyroid hormones. They both will have an increased levels with hyperthyroidism. Thyroid antibody tests can help diagnose autoimmune thyroid disorders such as Graves' disease and Hashimoto's, which is going to be decreased thyroid. We're not going to talk about that much in this presentation. You might get an ultrasound, which will look at the thyroid and surrounding tissues, usually used to look for thyroid nodules. And then you also might get a thyroid scan, which may clarify the size and function of the gland. The patient may have to take radioactive iodine to check for nodules or Graves' disease. If they have Graves' disease, the iodine will show up over the entire thyroid. So next, what are the medications and treatment for hyperthyroidism? So first we have our beta blockers. So these are going to be metoprolol, labetalol, propranolol. Don't forget it's your LOLs. This causes the blood vessels to relax and widen, which helps reduce symptoms such as tremors, rapid heartbeat, and nervousness. Remember, this medication though is only going to treat your symptoms with hyperthyroidism. This does not help with stopping thyroid production. We might have some side effects such as dizziness, lightheadedness, insomnia, and tiredness. So of course, when you see a patient who is prescribed these beta blockers, you want to make sure to inform them to change their position slowly and also check their pulse before they take their medicines. The next medication we're going to discuss is our anti-thyroid medications, or our thionamides. These medications are methimazole, or propylthiouracil, or PTU. You might see that. This actually inhibits the production of the thyroid hormone. Some side effects may include allergic reactions, leukopenia, and liver failure. You want to make sure to educate your patient when they take these medications to not stop taking them abruptly, and make sure they take with meals at regular intervals. Another treatment that you may see with patients with hyperthyroidism is radioactive iodine. So this is used to treat hyperthyroidism. Radioactive iodine is introduced into the body and collects in the thyroid, thus destroying the thyroid gland. Unfortunately, this may lead to hypothyroidism, so low thyroid, so you want to make sure to educate your patients on that. You want to make sure to educate them on the possibility of having a low iodine diet before the procedure. After the procedure, you have to instruct them to not use public transportation if they're going home. Make sure that they have a separate bathroom to themselves in the home, and drink lots of fluid to flush that radioactive iodine out. They have to use a separate bathroom because they may be considered radioactive, and you have to wipe down after they use the bathroom very thoroughly. So if they use a bathroom on their own, then that helps limit radiation exposure to other people. Surgery is also an option for people with hyperthyroidism. Of course, this may lead to hypothyroidism if they take out some or all of the thyroid. So in summary, hyperthyroidism is excessive thyroid hormone in the body. It can be due to different causes such as Graves' disease, toxic multinodular goiter, or thyroiditis. Remember, our symptoms, everything's going to be sped up. So they're going to be nervous, they're going to be irritable, they're going to have weight loss. Everything is sped up. The treatment includes medications, radioactive iodine, or surgery, and usually this disease has a good prognosis with regular checkups. And here are my references. Thank you.